Hello, my name is Tina Walter, and I'm a certified yoga therapist here with the Osher Center at UC Health. Also with me to model today is a yoga therapist named Sonia Verma, and we are going to guide you in a movement practice today. I've been teaching yoga therapy to people with cancer for over 10 years and have experienced firsthand the positive effect yoga has on cancer-related joint pain. People with cancer tell me most often that it's the breathing and the slow movement in yoga that helps the most. So today, props you'll need are a mat, maybe 2 blocks, maybe a cushion you can move from your couch or some pillows. A chair without arms might help. And we're going to work on a mindful movement practice to help release tension, relax muscles, and ease joint discomfort and pain, often associated with cancer treatments. These simple series of movements can be done on the floor or in bed if needed. And research increasingly links physical movement with better cancer outcomes. So the goal of this practice today is to empower you with tools you can use daily. Always listen to your body and move only to your comfortable range of motion. So let's begin. In seated mountain, she is going to lengthen from her tailbone up through the spine, up through the crown of the head, relax her shoulders, her jaw is relaxed, and just notice her breath. Soften your belly, your rib cage, and allow your breath to just be smooth and easy. Maybe close your eyes, softly gaze in front of you, just some gentle breaths to begin, in and out. And the breath is our most powerful tool in yoga. And when you breathe in and breathe out steadily, you can relax the muscles, which really has an effect on joint pain. Good, go ahead and blink the eyes open. Take a big breath and reach the arms up overhead. Big breath in and gaze up at your hands. Let's move the gaze up as you breathe in. And then take a hold of the right hand and allow a stretch over to the left. And just breathe. Maybe lower your chin, look under your armpit and breathe here. Good. Inhale back up. And we're going to switch hands. We're going to take the right hand on the left wrist and stretch up and over to the right. Just a gentle stretch to begin. Good. Inhale the arms back up. Now drop the right hand down to the floor and bring this left arm up and over for like a big rainbow stretch, up and over. To modify this, you can place a left hand on a left shoulder and just lift a little bit of your elbow. You can modify this if needed. Your right hand can be on a block. Good. Inhale the arms back up and go to the other side. Move to the other side, dropping the left hand down. Right arm reaches up and over, lifting out of your hips. And this stretch helps really open the rib cage. Good. Inhale the arms back up. Take a big breath. Good. And then exhale the arms back down. Now we're going to move into child's pose. So you're just going to come on to your hands and knees, gently shift the hips back into a child's pose. And you can do this in a chair also by just draping over a bolster. I'm going to move the bolster under Sonia so that she can stack her forearms on the bolster and place her forehead on her forearms and just breathe gently into the belly. See if you can ease into the stretch. If this feels too intense, you can always do this in a chair, breathing in and out. Bringing the floor up to you with pillows if you need to. Maybe one more deep breath in and out. And when you're ready, slowly, gently come up. Hands under shoulders, knees under hips. We're going to move into table. Good. And in table, we are going to work on some strength and balance in this position and core strength. So I want you to take your low ribs, knit them together and pull them toward the hip bones, and then the hip bones pull up towards the low ribs. You're lifting the sides of your waist and activating your core. Good, and just breathe here. Good. Take the right leg behind you, plug down the right toes, and then the left arm comes in front of you for a spinal balance. And this pose really helps build bone strength and flexibility and balance. 2 or 3 deep breaths here. If you want to lift your back leg, you can, but you don't have to. Good. Go ahead and release and move to the other side. Now we're going to take our left leg behind us, plug down the ball of the left foot, and then when you're ready, reach the right arm in front of you. See if you can activate your core, drawing in the low belly. Breathe here. Use that left shoulder, pulling it down your back. A lot of strength. Good, and then go ahead and release back into table. Good, and sink back for a quick child's pose. Just touch on the pose for a breath or 2. Deep breath in and out. Great. Now we're going to transition by standing on our shins and placing the blocks at the top of the mat. Right foot comes forward. And you can pad your left knee if you need to. Good. Bring your hands onto the blocks. You can move the blocks a little closer to you if you need to, so you can lift the chest. You're anchoring your tailbone down, lifting your chest. Really good. And this really helps with pelvic stability, mobility. Great. When you're ready, take an inhale and lift your arms, lift your chest, reach, relax your shoulders. Nice balance. Breathe here. A couple of long, deep, steady breaths. Good. Bring hands back to the blocks and transition to the other side. Take your time. Left foot moves forward, right knee down. When you're ready, again, activate your core, lift your arms, lift your chest, big breath. Maybe 2 or 3 deep breaths in and out. Noticing your stability. Just all the things that are working really well for you today. Good. Bring hands back to the blocks. Good. And transition onto your back. We're going to go ahead and come onto our backs now. Once you're on your back, begin to really relax the head and shoulders. And see if you can really feel like you can connect your back body. And you can do this in a bed also. This pose is called Apanasana. You're going to outstretch your left leg and interlace your fingers around your right shin as you draw your right knee into your chest. You're going to take an inhale, a big inhale. Good. Maybe just feeling like you can activate some of the abdominal muscles, feeling the breath in your belly, feeling like you can release some of the low back. Good. And then release that leg straight and arms up overhead for a big stretch as you inhale. Good. As you exhale, you're going to pull your left knee into your chest, interlace the hands around the left shin. And release the arms behind you for a big stretch. Release the knee. Good. Side to side now. Right knee as you inhale. Good. And inhale the arms up overhead. And exhale, pull the knee in. And inhale the arms up overhead. And see if you can flow continuously in this pose. Deep breaths in, deep breaths out. Connecting breath with movement. Maybe 2 more flows on each side. Good. and then bring both knees into your chest when you're ready. Give yourself a hug and rock side to side on the low back. Come up to your comfortable seat when you're ready. And take a moment in your comfortable seat. See if you can, just putting a block back under a seat to elevate the pelvis. And just sit up good and tall, relaxing the shoulders, relaxing the muscles in your face, relaxing the breath. Just notice how you feel. We will end the practice the way we began. Gently close your eyes or lower your gaze, soften your belly, and notice the quality of your breath. Just acknowledge this time of self-care you've given yourself. And on behalf of the Osher Center for Integrative Health, thank you for joining. We hope that you practice this daily and that this practice will support you and provide some pain relief. Have a great day.